Hello everyone, my name is Leslie Tatum and I'm the owner of Living Health, Holistic Healthcare here in New Braunfels, Texas. And I have started my journey in healing for about close to 30 years. I started in physical therapy, and that's how I got my education and all of that, but it doesn't resonate with me. So I turned around and started becoming just a lot of certifications in detoxing, in nutrition. It's a long journey. You keep learning more and more, and you're just, taking off on this path and this path. So I have about 30 certifications, anywhere from, drawing blood, IVs, to doing prolozone, ozone, and doing lymphatic. And what I really want to touch on today is hydrocolon therapy. It's not such a foreign word nowadays, and how it really assists digestion, and that's really important. So we do a lot here at Living Health as far as supporting digestion. One, I look at it in bacteria, something in the gut that we have to work on. Foods, I just touch briefly on foods because most people that come here really know their stuff on foods. But of course, less is best, and elimination on gluten and dairy, of course, less sugar. So we do touch on that. And so first of all, we really want to look at is what is your issue in digestion? Okay, so most people that come here in the past 20 years has been constipation. Constipation is a big deal, and I hear about it ever since I was little, or since I can remember, I've had constipation. So I look at that, and as far as it can be several things. It could be, of course, your gut flora. Have you been on antibiotics when you were little? All the way to thyroid controls digestion, your liver, your bile. Bile breaks down fat after you eat it. So a lot of people have their gallbladder out. What do we do about that? And so we look at that piece. And so that's when hydrocolon sessions come in, and we work on starting to, remind the colon, the peristalsis movement, on what to do and how. Oh yeah, I forgot about that. This is what it feels like to really release. So the body has a beautiful memory, and so it kind of just starts there. And then I really recommend coffee enemas. It's been around 100 years. I'm also a Gerson practitioner. I had the opportunity to study with Charlotte Gerson. And when she told me she did a coffee enema for 50 years, and in the afternoon she still has a bowel movement, that kind of blew me away. But just know that coffee enemas don't turn off your peristalsis movement. It actually stimulates it. It's not like a laxative would, if you will. So that really helps your, digestion. Bloating. Bloating is awful. And I look at bloating with bacteria. I really do. So I treat that in a different way that we'll touch back on, and an LDI that we'll talk about later. But I look at that. I look at, of course, digestive enzymes. Do you need some ox bile? But it's when you're eating, or even when you drink water, all of a sudden you look like pregnant. So that's what we really we want to get rid of. You don't want to look like you're pregnant, right? So we want to touch on that. And really, the hydrocolon work is beautiful. Digestive enzymes and treating the bacteria that's causing it. I have people that eat perfect, and they bloat like crazy. So they're just cooking with bacteria. So I find that. And then when you look at IBS, irritable bowel syndrome, is when you have, you have diarrhea, and then you're constipated. Diarrhea, constipated, kind of got a nervous gut. Well, just because you have diarrhea doesn't mean you lose all your mass. Okay, you lose the moisture in the colon. So that's why it dries out and then you get constipated. So on that, we really look at some calming, if you will. And again, I look at what's going to really support that. And what's driving that? Is a virus driving that? And which I really find a lot of. So we touch on that. And also always hydrocolon work is beautiful for that. It gets that constipation, that dry mass out, and you just feel so much better with that. And then, some people with Crohn's and super inflammation of the colon is, another one that's viral for me as well. But we look at, I have, several tricks of the trade, if you will, with my supplementation. And so I muscle test. I study under Dr. Klinghardt. He's fabulous. And so muscle testing gives you that precise, really what the body wants at this time and how much, or if you're sensitive to it. So I support the digestion in that way of testing, and we'll give you some more information on that as well. So there's a lot of things that we do. I have a great success rate. If people come to me with digestion, I'm like, oh goody, it's kind of just an easier approach. It doesn't have to be hard. People have that emotion because it's back memory things that, you have to live like this for the rest of your life. And you don't. If you eat and then bam, diarrhea right after, so you can't go out to eat, you can't leave your house, there's the things that I would pull in right away before, and that's bacteria as well. And I would bring in some binders. Let's look at some different types that you test for on bentonite clay or charcoal to bind that up so you have more control. So you can go out to eat and it chop, and it works really fast and it's not that expensive. So, but again, getting the right product is really important, I found in the past, because some people resonate with it and some do not. So I wouldn't go willy-nilly on that at all. So that's just something, that's why I've learned the way I do on testing, because I used to do that and that didn't work. So digestion, if you're not digesting well and going and relieving and having great bowel movements, it affects the brain. It affects your mood. You're just irritable. You know the feeling. And I used to bloat crazy. I'd go to lectures, I'd travel, and I would have to wear a whole different wardrobe because I would bloat so bad. And that's why I really connect with this one. And now I don't at all. That's what I had to find the key on really eliminating that. So I find it really works. Again, everyone's different. So the approach is sometimes quite different. So that's what I do with my testing. I find what's the best for you, so you're not wasting your time or your money, because I really like fast results as much as I can. Of course, what you do with your lifestyle, moving, you gotta move for the colon to move. So, but do what you really love doing, not like, I have to go work out, or, if you love dancing, go dance, or if you like walking the dog, walk the dog, just start with something, and that will help your digestion so much. So those are some little tips that we can go on digestion, because it's really the beginning. That's why I became a colon therapist. I've been one for 16 years. And I have, I've seen a lot, and it's just, I don't know why it's not on every corner here in America. I really don't. So I recommend that just totally. And if you can't do that, start with coffee enemas. Those are pennies a day. You can look up the Gerson, and it's very simple. So I hope those tips help with your digestion. And just reach out if we can help with anything. We're here for you. So thank you so much for listening.